The Centers for Disease Control and Prevention, or CDC, plays a crucial role in monitoring public health trends. Recent data from the CDC reveals a significant increase in positive norovirus tests across the United States. For the week ending January 4, 2025, the positive test rate reached 27.91%. This is more than double the rate of 13.52% recorded during the same period in the previous year. While this rise in positive cases is noteworthy, it is important to highlight that the CDC has not issued any official warnings or alerts regarding a norovirus outbreak. The agency continues to monitor the situation closely and provide updates as needed. It is also essential to consider that norovirus cases are often underreported. Many individuals experience mild symptoms and recover quickly at home without seeking medical attention. This underreporting can make it challenging to determine the true extent of norovirus activity within communities. Several factors could contribute to the recent increase in norovirus cases. One possibility is the emergence of a new strain of the virus known as GII, 17p17. New strains can spread more easily as people may have less immunity to them. Another factor could be a shift in the typical norovirus seasonality. Prior to the COVID-19 pandemic, norovirus infections typically peaked in December and January. However, in the years following the pandemic, the peak shifted to March and April. The current increase observed in early 2025 could indicate a return to the pre-pandemic seasonal pattern. Norovirus is a highly contagious virus that causes inflammation of the stomach and intestines, a condition known as acute gastroenteritis. Common symptoms include diarrhea, vomiting, nausea, and stomach pain. Some individuals may also experience fever, headache, and body aches. Symptoms typically appear within 12 to 48 hours after infection and last for 1 to 3 days. While most people recover from norovirus infection without complications, it is essential to be aware of the risk of dehydration, particularly in young children and older adults. Dehydration can occur due to fluid loss from vomiting and diarrhea. If you or someone you care for experiences severe or persistent symptoms, it is important to seek medical advice. Preventing the spread of norovirus requires a collective effort. The virus is highly contagious and can spread easily through contaminated food, water, surfaces, and person-to-person contact. One of the most effective ways to prevent infection is through frequent and thorough hand washing with soap and water, especially after using the restroom, changing diapers, and before eating or preparing food. Other important preventive measures include washing laundry thoroughly with hot water, particularly if someone in the household has been ill. Avoid consuming raw or undercooked shellfish, as these can be a source of norovirus contamination. Wash fruits and vegetables thoroughly before eating and disinfect frequently touched surfaces such as doorknobs, countertops, and light switches regularly. If you do become ill with norovirus, it's crucial to stay home for at least 2 days after symptoms subside to prevent further spread. Remember, antibiotics are not effective against norovirus, as it is a viral infection, not a bacterial one. By taking these preventive measures, we can all contribute to reducing the spread of norovirus and protecting ourselves and our communities.